Yes. Good evening, everyone. I'm Dr. Pawan Kumar Bobadi. Uh, Let me introduce myself. Uh, my name is Dr. Pawan Kumar Bobadi. I did my internal medicine from NR Medical College, India. After that, I worked as an assistant professor. So currently, I'm doing my PGY1 residency in internal medicine. Okay. I think how is the season for everyone? Is it too much emotionally dragging you? Yes. Yes, the season is too much uncertain this year. Like we had a lot of visa issues, and most of the programs are like thinking about uh, getting the IMGs. So there are a lot of concerns are there. So I have prepared like four things to be kept in mind while preparing for an interview. So the four questions are how to tackle the most challenging interview questions. Yeah. So we'll directly go for these questions. So my four things I want to discuss today is regarding the most challenging questions, how to answer them, and what are the strategies like we need to do to stand out in front of a program director, and common mistakes we should be avoided as an IMGs and the insider trips. So for any interview, almost like you across every path, the exams, the applications, and personal statements, and like your CV and everything. Right now, you need to convert your potentials into converted into getting matched. So this was the very critical phase. Even the small mistakes you did, like that will cost you a good program or like your residency and everything. So you should be able to convert your potentials into a potential match. So for these things, we need three things: clarity, confidence, and the connection. So most of the people which are missing regarding the thing is connection. We don't much focus like how we are connecting with the program director or the interview panelist. So always our conversations or like what we are going to say, those things like those should be connected to the program director. Program director is the one person who takes the decisions. So even the panelists also have some opinion, but the program director is the one like who has the ultimate thing to pick a candidate. So always be clear with these three things: clarity, confidence, and connection. Clarity means be clear what you are going to say. And confidence, be confident. Even you are clear in your things, what you are saying, but if you miss the confidence, if they feel that, okay, this candidate is looking too much anxious, or like he's not able to do not able to handle the situations, then they are not going to pick you, because we need to deal with the patients in US healthcare. The first thing very important is with having a clear communication with the patient. So we should be having a clear, confident answer. The other thing is connection. We need to build a connection with the program director. In whatever the short time we have, we need to build a connection with your personal story. Yes. So how to tackle the most challenging interview question? So after going through the multiple interviews with many program directors, I just got three types of different questions. One are common questions. The other one are the some difficult questions. The third one is clinical scenario based questions. The common question is the first one: tell me about yourself. Everyone will definitely ask you, tell me about yourself. So while you are saying about your tell me about yourself question, just always practice to complete your answer within 90 to 120 seconds. Don't cross the timeline, because the program directors are going to interview the candidates like 10 to 12 candidates a day. It depends on the program, like where you're going to be get interviewed. But most of the programs will do the interviews for at least 10 candidates a day, and the program directors have many more other things to do, so they won't take much time. So you need to present yourself in a very short and crisp way. So while saying tell me about yourself, so I have like figured out five different things which we should include in your tell me about yourself. The first one is personal details. The other one is about your medical school. Don't try to tell everything about your personal details, because everything is written in your CV and personal statement. So just tell where you're from, like any importance of your city or like the place where you're living. And the other thing for about your medical school, don't try to tell everything about your medical school. Just try to tell one or two important things and any other acknowledgements you have done in your medical school. The third one is why you wanted to be in medicine. Just tell them, is there, if there is any personal story, just try to complete the story in 1 to 2 lines. That's all. So you may be having a personal story why you want to choose the medicine. So try to tell that story. It's maybe an inspiration from your parents, from your professors, or like you have connected with the patient. So try to tell them why they want to choose, why you want to choose the internal medicine. The other thing about your US clinical experiences, just a short line. How many months of US clinical experience? Like if something have you're done from some university hospital, try to tell that, okay, I done this clinical rotation from these places and these places. After that, your future plans and hobbies. Some of the program directors may like your hobbies. That's the reason why they have picked you. It's not only about the academics, the US system works here. They always try to pick the candidates who have all other abilities too. So they may be liking your hobbies too. So they can have a conversation with you regarding your hobbies and everything. So try to tell about your hobbies, but don't tell them you like reading books. The common ones. Try to say some unique things. Okay. So this was the common question. The other questions like how to tackle the most important challenging questions. When the program director asks you like the few questions, tell me about your weakness, what do you want to do if you don't get matched, or like something like a different scenario based question, something like about your weaknesses. It's not like that they want to know about your weakness, they want to know how you have improved from your weakness. So you can say that, okay, I'm bad at my communication skills, maybe I'm a little bit self reflective. It doesn't end like that. You need to build a story. Yes, I have a habit of self reflection. So I know about my habit. So I work with a clinical scenario, something like these things I have done and improved, and you shown the result. Always show the result. So this is the STAR approach: situation, task, action, and result. So when you are saying a thing about your weakness, always say how you have worked out about your weakness. This is meant to show your growth, how you have like improved your growth, or like you want to show your insight. So always show the positive things, or like your growth potential or the insight. So it just means reflect yourself. So any difficult question, just approach with this method: STAR approach: situation, task, action, result. So always show your growth. This is the thing like you need to mention in your questions. But while saying your answers, be authentic. Don't try to say the things not you have done. So always say the things like be genuine, be calm, and be humble while saying your answers. So if any time you didn't understand the question, or like you're moving out of the zone, just try to ask the program director, are you asking about the clinical scenario based, or like from your personal life? Because sometimes the program directors want to know about your personality instead of in the clinical scenarios. So you can ask them. It's not wrong to stop them and like asking the question again. So when you have a doubt, please try to stop and ask the question again, but don't say the wrong answers, because wrong answers will definitely result in the wrong places. Okay. So what are the strategies we need to do to stand out in front of a program director? When we are getting the interviews, the most of the people will do try researching the programs about like before day of your interview. Please don't do that. Always research your program well in advance. So researching means just know about your program director. Who is the program director? What is his specialty? So what interest he has? Like we can know much of the things from the profile from the website itself. So what is his research background? does he have done any research articles? If you have a same sort of research article, try to connect with us. You can mention his research article thing. So I have like gone through the your profile and just seen you this sort of article. So I was so much interested in your research publication and something. It will make the program director aware that yes, you researched about the program well, and you researched about the program director, and you are interested. So it will show some sort of curiosity. And it's not only about the program directors, just try to know about the goals of the program. Where is the location of the program? Is it the community based? Is it university based? Or like what are the goals? Like what are the prime population they are targeting? So when you know about these things, just try to build your story around those things. So always prepare for your interview in well in advance. So most of the people are getting the interview invites by now. Probably by next month, you'll definitely get more interviews. So when you get the interviews, try to research the program well from the website about the program director and about the panelists. So you always get the list of the persons like you're getting interviewed. So always look after the persons, the profiles and everything, and prepare a list of things what you want to talk in the interview, and always be genuine. Show curiosity. The program directors and the programs need some curiosity. You're saying something that is way out of the league, then the program directors doesn't want to pick you. So always show the emotional intelligence. Emotional intelligence means like, please don't say while you're talking, please have a gentle smile. And also please show some connection with the program director. If you're sitting idle and just like listening to what the program director is saying and being stiff, it doesn't matter. So always show some kind of emotional intelligence, like go with the flow. It's better go with the flow. So other thing is align your goals with the programs. The most important strategy of this is please align your goals with your program. If this is a community based program, so most of these are focused on the community backgrounds. So you can say this like this: oh, I worked in a this community set in rural service in your home country in this place. So you can show them, oh, you already had a community based background from rural India, or like from your home country. So it will connect with them. So my inference from this thing is always research well in advance about the program, research about your program director and your panelists. And if there is time, try to connect with the residents who are there in the program. Most of the residents won't respond to you. If they respond, you can get some insights about the program, what the program is targeting, like what type of residents they want in the program. So you can know about that. Always be genuine, be clear, concise, and have a good communication with them. Show emotional intelligence. Always align your goals with their goals. So most mistakes must avoid during interview. The first thing is while having an interview. So the most of the interviews will be having a timelines. So they will be war zones. So something like we'll call it as the war zones in the interview session. So they will call 10 people at a time in the interview. They will be having 4 to 5 panelists in the interview. So we'll be getting interviewed with one person. So we'll go back to the war zone. Something like they name it war zone, but it's not a war. Okay. So something like a waiting room. In the waiting room, they will try to connect with the other residents and the chief resident. So they always ask you, what are your habits? Like, what do you want to do? Like, what your talents, or like, what's your hobbies, everything. So while saying those things, it's just not like a normal conversation. The chief residents want to know about you. They will be very formal with you, something like, okay, they are talking like a friend to you. But in your background of your mind, keep this thing. They want to learn more about you. So tell the things like what you want to do in the residency there itself. So the chief residents will know, okay, this is a good candidate for me. So I can pick this candidate. Like I can give the suggestion to my program director regarding this candidate. So Please don't be robotic while giving the answers. Be natural and genuine. The other thing, what most IMGs do is like interrupting the panelist. While the panelist is trying to say something, so we'll get something in our mind. So then we'll stop them like in the midway, like, okay, you want to say something. So always give time for the panelists to complete their question. So then you can answer that thing. But in the midway, if you're not understanding what the program director or the panelist is saying, like after he completed, just tell him, like, can you please repeat the question? So it's not wrong to ask them to repeat the question, but it's always wrong when you say the wrong answers. Okay. The other thing is taking too long time. Always prepare your answers for less than 90 seconds. Like if the question is about you, tell me about yourself, always try to complete the answer within 90 seconds to 120 seconds. Please don't take more than that, because our attention span is very less. When you are taking too much long time to tell about yourself, then they will forget like what you're going to say. So always tell your crisp points, like what you want to say. So don't take too much long time. The other thing, like we do the mistakes is not having meaningful questions at the end. So whenever the panelist is completed, they will ask you, so do you have any questions for me? While doing the interviews, the most common question like I seen is, uh, what are the research facilities your program is providing? So every person will ask the same question. So how they gonna remember you? Because you all from the same academic backgrounds, you more or less you will be having the same scores, same sort of clinical experience, same sort of research and everything. Because before reviewing their application itself, they keep some filters. So they will remove all the candidates who are with the less scores, or like something like every program has some criteria. So they want to try to pick some sort of clinical experience and everything. So all the candidates will be same or other line at the same level. So have the meaningful questions at the end. So always research about your program. So if the program is offering about a focus program, just you can ask them. So I just seen in your program website you're offering focus. So how do you want to make us learn about the focus? Like how many weeks, or like how is it going to happen? Or so always ask the meaningful questions, not the common questions everyone are asking. If you are literally interested, you want to ask about the research, be specific. So you can ask them, okay, uh, because for many of the community programs won't have the specialties. If you are going to say that I'm so interested in gastrointestinal research, if the program doesn't have those specialty there, like what do you want to say? It will shows that you haven't researched about the program. So always research about the program, what specialties they have. So whether they have any fellowships in hospital fellowships are going on. So you can like mention those things. So you can mention your future GI fellowship interest, or like cardiology fellowship interest, everything. So always have a meaningful questions at the end. Don't have the similar questions, the same thing which other people are asking. If you are asking the same questions, they don't gonna remember you. They don't want to pick you. So other thing is negative talk about the previous training or the system. So most of the hospitals will ask you, why do you want to come to US? So we all of us know that why do you want to come to US, because like it was most advanced, like they pay much better, like better work-life balance and everything. But we shouldn't say the answer like that. So my country doesn't have the EMR, like I want to work in a system of EMR. Please don't say like that. Always say, always say the positives about your home country or your previous training, and just show them you want to upgrade from this thing to this thing. Instead of saying they don't have the EMR, I want to work in a system with EMR, I want to learn more about these things. So always show the positives about your previous training. Don't say anything negative about your training. Because if you're going to say negative about your training where you have worked for 3 years, 4 years, and 5 years, you're going to do the same thing with the same residency program you work now. So they don't want to pick you. Every system has some flaws, whether it's your home country or in US. So every system has the flaws, negatives, but we should focus more on the positives. Instead of taking much negatives, take always the positive things. The program directors want to learn more about your positives instead of the negatives. It's okay to say about your negatives, but always show them how you have improved from that negative to positive. So don't say anything negative about your previous training or the programs. So other thing is weak setup. We always focus on preparing the interviews. We'll have a mock sessions and everything. But the common things which we miss is the weak setup. So always try to plan your room in way advance to have a neutral background. You can showcase like your talents. If you are a painter, you can like keep the paint you have, or like any sort of arts you have, you can display them. Always buy a good quality camera, good quality audio system, and good background. Even if it is a neutral background, that's fine. But always try to get a room with no noises, good internet quality, good camera setup, good audio quality. These are the most important things. Because while doing the interview, if the program director or the panelist like faces difficulty that you are not audible and you are not visible, then it's not gonna help you. Because they will give the interviews in 1:10 ratio. For every one residency position, they're going to give 10 to 15 interviews. So you need to be the best among the 15 candidates on that day. So always try to invest some money on your good camera, good laptop, good background. Okay. Please be sure about these things. Please don't be robotic in your answers. Be natural and go with the flow. Don't interrupt your panelist. Always make your answer short. Always have the meaningful answers in the end. Don't talk negative about your programs. Please have a good setup. So my last thing, the insider tip I want to give as a residency perspective is always focus on the connection rather than the performance. So we already discussed this. You're all other from the same background. So you all having the same scores. You're all having the same scores and like same background, same clinical scenarios and everything. Sorry. So you always have the same academic background, same clinical experience and everything. So it's not an exam. It's not an exam to give you grades or anything. So it's always they want a connection with you. So because they are going to work with you for 3 more years. So while you're having these connection, then they can know like, okay, this person I can work for 3 more years. He's a good one. So I can pick him. So always try to form a connection with your personal story. It's not an exam regarding your performance. It's always they want to know your personality. It's an assessment of your personality. So the other thing which I want to say is, so don't do mistakes, don't mumble, be clear, concise, and confident. Be good with your communication. The way I'm saying is about the communication means doesn't like talking good in English. It's all about saying what your thoughts. Put your thoughts like what do you want to do as a resident there. So how do you want to be a good man, like a good person after joining the residency? So how do you want to improve yourselves? How do you want to be an asset for the program? So don't say about your programs just it's a good program. So that's why I want to be in your program. No, how bad is the program can be. You should be a good candidate. You should make a difference in that program. The good programs doesn't make a difference for you. You need to make a difference in the program. So always showcase your abilities, which you can do. So always clear, concise, have a connection with the program director. This is what I want to say, guys. So if you have any questions, you can ask me.
Is there any particular mic and webcam combo that you suggest?
Mic and combo. I just bought something like 4K resolution camera. So I haven't had any specific type of brand. but like it's better to invest on the 4K camera. So other things I want to say is like always have a mock interviews with the other persons. So something like you may be having your friend or your guide or something. While you're having the interview with other people, try to have a screen recording. Something like you can record with your phone. Then you can know how you are performing yourself. Please rate yourself while taking in screen like something screen recording like that. So then you can know, are you being stiff, are you being emotionally like available like emotionally answering your questions, or just like you're answering in a robotic way. So always try to record your answers, always have the mock interviews. So you might have gone through a different path: exams, application, PS and CV. It's all just like it's something like a 70% of the work. But if you want to complete your 100%, 30% is balance. That 30% is your interview. If you want to get a good match, always have good mock interviews. Why I'm saying this is because like I missed some of the interviews like this because I just didn't got the time. So I missed one or two good programs in the initial days because like I didn't get the time to practice everything. So by the end of the season, like I got aware of my mistakes and like had a good mock interviews and everything. Like I finally did this thing. But I want to give a suggestion regarding as a senior, please do mock interviews as many as possible. Then you can give the good sort of answers which are clear, concise in your interview.
Also, what's your opinion on using hand gestures during the interview? Should we minimize them or should we use them?
Oh, yes. So hand gestures, I think our screen will be very small one while we are doing the interview. It won't be much visible, but they won't see our hand gestures. So try to minimize the hand gestures. So it's better show everything in your face, but have a neutral expression, something like a gentle smile. Everyone do your interview best in this season because we had a lot of visa issues this year. So most of the programs are like try to get those from the American medical graduates. So give your best interviews this season. This season was the toughest one when compared to the last year because we all know there are some issues going on. So always give your best interviews, have a good preparation. Always schedule your interviews in the early part of the season, not in the end. Don't think that you will give the best interview at the end of the season. By the end of the season, most of the spots will be filled. So always plan your interviews in the early part of the season and have good mock interviews with your friends, with your colleagues, with any sort of guidance programs, anywhere. But always have the mock sessions.
Also, as IMGs, by what time can we expect to get interviews during the season?
So the ideal time, I will say about my experience itself. So in the early part of the October, I didn't got any interviews till the end of the October. But from the start ending of the October, I got all the interviews. So from the starting of the October to the end of the November end, I got the interviews. So there is not a proper timeline to get the interviews, but we'll definitely start getting interviews from the end of the October, but not after the December.
And how should we time sending letters to the program directors for emails? Should we start now or another time?
So I'll tell you the practical thing what goes here. So for every program, there will be applications. Whatever the small program will be, there will be 3,000 to 5,000 applications for program. So the program director will be having very short time because he will be dealing with the patients, his clinics, the hospital academics, and the other things like as a program director, they will be having the other financial issues and everything regarding the hospital. So are you thinking that at least like if 100 or 200 people send the letter of interest and everything, so will they going to review your application? I don't think so it happens, but 99% it won't happen. For 1% a chance, like we can send those letter of interest. Like it's a good time to send letter of intents now itself, but don't think that they will respond. most of the programs will keep their email in block list, so they won't get the mails from the outsides. So every hospital have their own system of getting the emails, something like a Microsoft Outlook. So they will keep it in the block list, so your letters won't reach them. But for 1% chance, like some good program directors will be there, like who will review all the applications, like react to the every emails. So you can try for that 1%. It's not it's worth trying for the 1% too, because we never knows who will respond, but 99% of the program directors won't respond to your emails. I'm not saying that like they're arrogant or like they don't want to consider your applications. Just because of the lack of time they do these things. They can't see all the emails they get every day, because like if the program has 5,000 applications, if they get 100 mails per day, just think in your program director perspective, do you gonna respond to the emails, 100 emails you get from the random people? I don't think so.
And what is the best way to approach a program where we have done our rotations previously? Should we message them, text them, email them, call them?
So reaching out to a program where you have done your clinical rotation, so it always gives you a edge when compared to the other people, because they will know that okay, this person has worked here, so he know the system, how it works here. But uh, it's always good to have a connection with any program, because like even with a small connection with the program will definitely get you a spot there. So if you really have a good connection, like some person is there to owe you, then it's always better to reach them. How far the connection is, like it's better some connection is there, so you can reach out to them, like by any means. Most of the people will respond to, like if the person is so close to you, or like you work very close to him, then they'll definitely respond to your emails. I think no calls. Most people don't like calls here, because they have their own calls and like own shit going on for them. So it's better to email them, or like if you have a WhatsApp number, you can do that. But it's better to do a mail.
What do you think is the best way to address a program director while giving
Address
the
in. Oh yeah. So can you be specific regarding your question? Because addressing in what sense?
like when you're giving an interview, do you just say them as Dr. So and so, or do you say
Yeah.
sir?
Yeah. Instead of saying sir, it's always better to call them doctor with the first name or last name. It's better. Something like I can call you as Dr. Irfan. It's the best way, because the work culture what we have done there is like we usually call the professors or the seniors like sirs or madams, but in US it's a different culture, so we usually call them as doctor. We call them as their first names or last names. Most of the people like will call them by their last names, so Dr. Irfan, Dr. Shah, something. So try to address them as doctor, not so as a ma'am. So most of the people will feel offended if you call sir or madam. Yep.
All right, thank
Any other questions? Oh yeah, that's fine.
Is there a particular format for the letter of interest that we send out?
Letter of intent. So the original essence of the letter of intent is that you are showing interest in your program. So you should mention why you are interested in the program and what qualities you have to like be a good resident for them. So just research about the program, like always mention the qualities what the program is looking for and showcase your things there. Letter of intent means just you can the common format is like you will mention your name, your AMC ID. These are the common things for any letter of intent. But in the core part, always mention why do you want to be in that program, or like show them like you have these qualities to a better fit in that program. But always look for the qualities what the program is looking for.
And do we attach our ERA CV with the letter of intent or not?
Yeah, you can attach your ERAS CV, but always mention your AIMS ERAS ID, the AMC ID.
What are the things that we can mention while giving an interview regarding the program? Like if they ask some things, and if you want to mention certain things about the program to let the doctor know that we're interested in the program, what kind of things can we mention?
So it depends on the program itself. So if the program is a community-based program and they're focusing something, I can say it as an example. Yes. So if the program is from a New York, from a Bronx area, so there most of the population are um, from the African background, so the area. So it based on like providing the affordable care to them, easy, affordable, like so they will be having the multiple hospital entries. So you need to say that you need to showcase that you worked in the same sort of setup in your home country. So something like I used to see this number of patients every day, like you can mention those things because uh, they need the people who work for long hours. So in US, like most of the times our work hours will be to 8 to 12 hours max, so we don't cross the timeline. But in the timeline we'll be having a cap 5 to 8 patients or like 10 patients. So just show them you work in the intense environment there, so you can do the same thing in the program. They won't make you to work for long hours or like for multiple patients, but you should show them like you already had the strength to tackle the situation. Have I addressed your concern?
Yeah, that makes sense. Thank you.
Yeah.
Also, if someone has scored high during the step exams, would talking about the scores during the interview come off as bragging?
Oh, yeah. So I'll tell you regarding this thing. Most of the candidates from the last year who got the highest scores are also got unmatched, and lowest scores also got unmatched. So the interview is not about your scores because they already know about your ERAS application. So they know your step one score, step two score, and step three scores. So it's worth mentioning regarding your step three. Like you just like if you're not complete your step three, you can say you can complete your step three, and like you can say them, yes, I've given the exam, like I'm about to give the exam. But it's not much worth mentioning regarding your step scores. They already know about your application. While coming to the interview itself, like they will have a brief look for 1 to 2 minutes, like what are your step one score, when you given your step exam, when you given your step two, like what was the timeline gap, have you given your step three or not. So they all know all your details. So the thing I'm saying is the interview is not about your academics. Yeah, academics also plays a role, because like those are the ones like which made you good candidate to sit in front of the interviewer. But try to showcase your personality. Try to show them like what qualities you have, what pros and what cons. Regarding the cons, like what you have done to make them improve. Just show your personal, like just, something like it's a personal interview. It's not about an academic interview. Just showcase your personal growth, your personal story.
So, will they be asking academic questions at all? Like, would that be
Oh,
part
yes.
of the
No,
interview?
no. Yeah. So this was a nice question. So for some programs, like out of all the interviews, for two places, some program directors has asked me regarding the clinical questions. So they will give you a clinical scenario. They given me a clinical scenario with a heart patient with chest pain, like without ECG changes and without troponin elevation. So what are you gonna do for this patient? So they will also ask clinical questions, but it's very less. Out of 100%, only 10% times I got these clinical questions, but 90% of the time, tell me about yourself. What are your weakness? Why do you want to come to US? Uh, they will try to ask you questions about if you have a research. They'll definitely ask you about your research article. Please be clear about your research. It's not just like keeping your name, research something you may be in the second name or third name, but you need to know about the research what you have worked on. If you're not going to talk about your research there, they will definitely know, yes, these candidate have doesn't done the research, just he kept the name there, just he might have bought the article. So always clear about your research. They will definitely ask you about your research article, like just like something they can ask you, and can you please brief me about your research, what you have done, something like that.
Okay, that makes sense.
Yeah. Be thorough with your CV. Be thorough with your you, some of you have like given the LORs, you maybe your program directors or like your attendings has given you LOR, but you might be giving your LOR like the brief part to them, so they will make corrections and they might have uploaded it. So if you know about your LOR, that's fine. So be clear with your LOR too. Like if you have mentioned something regarding about a case, or like you might have said like I work regarding this neurocytic cirrhosis case or something. They're gonna ask you regarding, okay, you mentioned that in your LOR like you work for a neurocytic cirrhosis case, something like that. So what you have done for this patient, like how the patient came. If you doesn't know about your LOR, that's fine, because like most of the LORs will be uploaded by the attendings. You don't know about your LOR, that's fine. But if you written your own LOR, like, and you forwarded your attendings, be clear with your LOR. Mainly clear about your research.
That was really helpful. I assume that a lot of questions that they're going to ask are going to be regarding all the experiences and everything that we mentioned in our CV, maybe. But other
No.
than that, what are the
Okay.
kind of questions that they ask? What are
Okay.
the
So
questions that they want to know about us, other than the CV?
yeah. Okay. So other than the CV, so 60 to 70% of the questions are common. Tell me about yourself, about your weakness, any like any interesting case you have worked on. So any negative things you have, something like what's your flaws? What do you want to do if you don't get matched this year? These are the common questions which you usually get. So the other questions which you get is like the clinical scenario based questions, something like if you're working with your colleague, so your colleague is like not in agreement with your plan of treatment. What do you want to do next? So these are the common questions. Maybe your senior is not in agreement with your treatment plan. You want to do something else, but you know that the senior is doing wrong. How do you want to tackle the situation? These are the common questions which you will definitely get. So be prepared for the every scenarios, but don't try to say them. You want to do everything on your own. Just mention thing, okay, if the scenario like the senior is doing something wrong for the patient, but you want to correct them, what do you want to do? So here, at the end of the day, what is important is the patient health, and his patient health is the most important one. We shouldn't do any harm to the treatment. uh, by our treatment, we shouldn't do any harm. So you can mention that, yes, if my senior is not in agreement with my plan, but it risking the health of the patient, so I'll try to have a conversation with my senior. I try to want to explain why I'm thinking of this diagnosis, this treatment plan. If he's still in disagreement with the plan, then I'll go approach the attending, and I want to let him know like what's going on, like why do you want to keep this treatment? So attending is the one who will like authorize the treatment plan. So you can say in this way. So, but don't say that, okay, I won't be in agreement with my senior, so I'll keep my own treatment. So don't say those answers. But your interview will be for the short time. Maybe the interview getting 15 minutes or 20 minutes with you, but the whole interview session for some programs will be for 3 hours and 4 hours, because you will be in the waiting room. So be prepared for that type of scenarios. For some interviews, it may take around 6 hours to 7 hours, because like you get spot at some maybe at 6:15 one panelist, and another 8:15 you get another spot. So there will be a lot of time in mean way. So in the mean way, you will be talking with your colleagues, like who will get the interview, or like with the chief resident, everyone. So in the meantime, just develop the habit of sitting for the long time. You can have your coffees and everything. They don't mind anything while you're doing those things. But like, be picky about saying your things. Don't say the common generalized things, but be professional. Uh, say the genuine things.
So I wanted to ask, how does it exactly work? How many people are exactly taking our interviews? And is there someone who's asking us questions before the interview?
No. So it depends on every program. So because like, for some programs, like the only program director has interviewed me. For some programs, there are 5, 6 panelists. For some programs, like, even the chief resident will be also in the panelist. So it's not a common thing, a common ground for all the programs. So it depends on the program. We can't say that who will be getting interviewed.
And you mentioned that we're gonna be stay like once we schedule the interview, right? So what's
Mhm.
gonna happen after that? You mentioned that we're gonna stay for like 3, 4 hours, maybe more, maybe less.
Yeah, yeah.
So before the interview, so the camera is still gonna be on, and we'll
Uh,
is it be like that?
No, no, no. Yeah. Sorry for obstructing you in the midway. So you can turn off your cameras in the midway. So it's not compulsion to on your cameras. Like you can turn off your microphones, you can turn off your cameras. Like you'll be having the leisure time in the midway. So they won't ask you to make your camera turn on.
So the time that is given to us for the interview, we have to join during that time, but we probably have to wait for some time before the actual interview begins. Is that right?
Yes. So you will be on the Zoom session or like from your Thalamus or something like that, the platform they are using. So you will be on the line, and they will the timeline will there will be a timer there. So they will let you know, the program coordinator will let you know you will join at this time. You will get a notification. So you will join at 7:15. So before that, your program coordinator will text you in the chat. In the chat box, they will let you know, Dr. Irfan, you're going to join in 5 minutes or 10 minutes. You're going to join at 6:15 or 6:30. So they will give you the time. Don't worry about those things. Like they will take care of those.
Okay, thank you.
Also, in interviews, how do we handle questions whose answers we may not know?
Okay. So are you saying regarding the clinical scenario, or like about your personal question? Because like, the question you asked is very generalized. So if I can say that you have done a research on some stroke, if just like, Mr. D, like, can you please tell me about the research article you worked about your CVA? You haven't answered, like, there's a difficult situation. It depends on the question they ask. But if it's regarding your personal question, then if you haven't answered, then you are in a, yes, in a black mark, something like, they will know, okay. But if it's regarding a clinical scenario or regarding your senior or something like that, maybe a clinical judgment question, then it's fine. You can say your own answer. Even if it is wrong, that's fine. They just want to know your personality there. It doesn't mean to be 100% correct. And regarding the clinical questions, means the scenario based questions, they need not be 100% correct. It may be correct from my perspective, it may be wrong from some other's perspective. So there are no 100% agreement whether this question is correct or wrong. Just say your thoughts, say your opinions. They want to know your opinions. It's not about the agreement. It's just to know about your opinion or your mind. That's all. If you don't know any answer, please tell them, oh, sorry, uh, I'm not sure about this answer. Something like that you can say. But don't create that type of scenario. Try to say some sort of answer, like a general answer.
So which one's better though? Like if we don't know something, if we don't know the answer, is it better to just apologize and not answer the question, or is it better to try to come up with something even if it's wrong?
So if it is too way out of the league, don't answer. Something you don't know anything about that answer, just sorry. I think most of the questions they put, like you won't get that type of scenarios until unless, like I said, these questions regarding your research or your some sort of publication or some sort of your LOR, the patient you work. If you haven't answered regarding those things, then that's a problem for you. But most of the questions they ask, like you can able to answer something, some other less you are able to answer those questions. But if you are not confident about your answer, say that like, okay, sorry doctor, I cannot answer, I'm not convenient. You can say that, okay, just apologize them, like, okay, I didn't get this answer, like I'm not confident about this answer. You can say that thing. Humbleness and truthfulness is the better one instead of saying the wrong answers.
Also, what is the post-interview etiquette? As in, suppose I'm done with my interview, I'm the first one to be done with my interview. Do I still wait in one of the rooms on Zoom, or do I leave the Zoom chat altogether?
No. So after your interview is done, like you can like sign out from your Zoom session. So the initial part of the interview itself, they will say after you're complete done with your interview, for every other persons, every other panelist, like you can come out of your interview. But after interview, even they respond or doesn't respond, try to send email, like a thank you email regarding the conversation you had, like mention some sort of one or two positive things, like you had like learned from the interview, or like you had something like a program director had like talked about some research or some about your personal story, or like your hobby habits or something like that. Just like try to mention, okay, we had this conversation regarding this, like I felt happy regarding these things. Try to include one or two things like what you have done in the interview, instead of like keeping this much long interview. Just tell them thank you, like for giving me this opportunity, like I was so much interested about these aspects of your program, I like these parts of your interview. You can say that.
I wanted
Yeah,
to ask
someone.
about something. If you have a certain number of researchers, like 16 or 17 researchers are published under your name, and of course it will be really difficult to remember every one of the researchers you have done. But you remember the ones you were core part of your, or you were the lead author. So is it fine if you don't remember some of your researchers, but you remember the one you were actively part in, like if you were the lead author or you were in the top three authors?
Yeah. So regarding these question, like I can say one thing. So they always try to ask you questions regarding where you was the lead one. So they will just ask you the brief part of your research. They are not going to ask you like, okay, what is this ratio? Like how much patients you worked on? Like what was the positive result? What was the negative result? No, they just want a brief thing. They want to know you really work with the patient or not. But they will always try to ask the ones like you are as a lead one, or else if the program director is something like he's from the GI background, then he gonna pick you at the research what you have done regarding the GA. So try to research about your program director in way advance. And regarding your panelists, you can get your info from the hospital websites. So if the program director is from something from a cardio background, like he always try to ask the questions from the cardio. Even if you have done 15 articles, he's not gonna ask you regarding the GA if he is from cardio. That one is expected. So always do the research regarding the program. That's what I can say. Have I cleared your answer, Ms. Priyanka?
Yeah, I understood that. Thank you.
Mhm. Yeah. Any other questions? Okay.
Yeah, I want to
Well,
ask that. Just last question. I want to ask that.
oh
What is
yeah,
the
that's fine.
general? What's the general way that we should talk? Like, what's the general etiquette of conducting the entire interview as a interviewee?
I didn't get your question. Can you please specify like what you want to know?
I mean, is there a
Etiquette in
specific
what
way
sense?
that we can actually talk in? Is there a specific way that we should, answer all of the questions? Are there some pointers for that in the way that we should speak?
So this is what I have said during my webinar session. So don't be robotic. So don't follow this sort of guidelines. So this is an interview not regarding your academic sessions. It's regarding your personality. So be like yourself. Be natural. Don't be robotic. So don't try to answer the questions in this manner. I just said only one format, the two regarding your weakness or like any scenario, something like the star approach. So always try to showcase like what you have done yourself for the improvement and what results you got. This is the format for your weaknesses or like your any clinical scenario, something like that. But there is no general etiquette like what we should follow, like something like that. But be natural, try to be genuine, just talk from your heart instead of like going with a robotic way. Just talk with your heart. It works much better.
Okay, thank you.
Yeah. Okay. Thank you, guys.
Also, in brief, it had been previously addressed how to keep the background, but to be more particular, should we keep trophies or other such achievements we have had in the background?
Yeah, you can keep those because
Trophies,
like they will know, because like if the program request from a sports background, like he might be get interested in your application. So it's not only your academics, it's the all-round candidate they want to know. Maybe they will like your sports etiquette, sports background, maybe your arts background, like something like the story that what you have said. They at the end of the day, you need to build a connection with him in some sort of way. So you can keep anything, but don't try to fill all your background with different things. Just try to showcase your one personality or two personalities. That's all. Don't or try to show everything you had in your mind. Okay. Don't try to be a generative AI. Just like be yourself, showcasing your one or two personalities. That's all.
and suppose we have to do the interview from a place of work. So, in that situation, is a blank canvas like the one you have in the background preferable?
So that one is preferable. But if you are doing an interview from the workplace, I always suggest you don't have the noise in your background. uh, do be in a place with good internet connection. Even if you loses the connection in the midway, you can mail the program director, you can call or message or like email the program coordinator. They will try to help you. But my sincere advice to you is like always choose a place with less noises, with no power or like these things like the internet connectivity loss. The first thing is be in a place with quiet environment. You had only one choice. Getting the interviews this year is the difficult one. Don't lose that opportunity just for 1 day of work or something like that. Okay, have a proper sleep before your interview, and like be in a place with good environment. Don't lose the chance you got.
Thank you.
Yeah. Okay.
Supposedly, if there is a power outage or internet issue, a connection issue during the interview, is there any way to handle that, and how can we approach the program director regarding the issue?
Yeah. So regarding these things, um, the program coordinator and the programs will be so helpful to you. So you can mail them, or like even we lose the power, we'll be having a phone. So in the phone, you can mail them and you can tell them like what's going on. So they always tries to help you. Okay, don't worry about those things. But the thing I'm saying is, when you have the power and the internet, but there is a lot of disturbance in your background, you haven't invested on a good camera, then it will be a red flag. Go
Sometimes,
on, go
like
on.
living back here at home, the noise around us is outside our control. So during such a circumstance, can we use earphones or headphones?
Yeah, while doing your interview, you can use your headphones, like AirPods, like headphones, everything. They won't particular about those things. They want you. They want to see your face. They want to listen your voice. They want to have a conversation with you. So just uh, invest on those things. Okay, don't worry about the other things. Okay, if it is too way out of the league, then you can't do anything. Just like you can search for a room with the closed doors, like you can do that. Don't think about the way other things which are out of your control. But if it is in your control, try to make them as good as possible. Thank you guys. But my advice is, don't lose your interviews, opportunities you had. Try to get as many mocks as possible. Like do your interview sessions with a good professionals, like, or your attendings, or like you know best, but not with the people. You can have the mock sessions with your colleagues, but that for the general part. But for your interview correction, always have invest your things on getting a good mock interview with the other people. Okay, because professionals will know like what's wrong and what's not wrong. So I done some mistakes in my interview, but you don't do these things. Okay, do the mock interviews as many as possible.
You. Thank
Thank
you.
you so much for your time.
Yeah, it's fine.
Yeah.
Thank you. All the best for your match.